The best 5 exercises for C5-C6 disc bulge for neck pain and arm pain relief. Let's get started. So here are the exercises to do in this order. Number 1, we're going to do what we call cervical range of motion. So cervical range of motion means we're going to bend forward. That's what we call flexion. Hold for 2 seconds. We're going to come backwards. We're going to go forward. We're going to come backwards. Forward, backwards. Flexion, extension. Flexion, extension. That's 5. Number 6. Number 7. Number 8. Number 9. Number 10. So notice we're just going through what we call a range of motion. Now we're going to get into what we call lateral flexion. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then we're going to get into what we call rotation. So again, notice we're just going through what we call range of motion. None of this is necessarily a stretch at this point. We're just getting some movement into the discs, into the vertebrae. So 1, 2, 3, 4. Nice and controlled. 5, 6, 7, 8, 9, 10. So this is important. Anytime you stretch, you actually want to warm up first. That was simple cervical range of motion. Now we're going to get number 2 into some what we call some cervical stretching. So for instance, if I wanted to stretch this side of my neck, ideally I'm going to come off to the one side. What I'm going to do is I'm sitting on a stool right now or a chair. You would actually hold your hand down here. We go to the point where we feel a good stretch. We're going to hold that for about 10 seconds or so, and we actually want that stretch to ease up. And then when we're finished with that, we're going to go the other way. Okay? Again, till I feel a good stretch. Again, I'm going to hold for about 10 seconds or so. I don't necessarily need to count because I can actually feel the stretch ease up, and then back the other way. Again, we're just going to do 3 reps either way. So one way, back to the left again, hold for a good 10 seconds, feel it ease up, come back again to the right. When we do this, we can play with this. This is a slightly different stretch than if I turn my neck this way, or turn my neck this way, or turn my neck this way. Same thing. Play with it till you feel a good stretch in that area and through here. And then if you're really gung-ho, when that stretch eases up, you can go a little further. But again, this is slightly different than if I put it this way or this way. Actually pay attention to the stretch you're feeling in there. Number 3 is what we call isometric strengthening. So isometric strengthening, isometric means that we're not changing the length of the muscle at all. So for instance, we're going to start very simple in flexion. We could actually put our hand here and then we're just pushing forward against our hand, holding just for 2 seconds. Okay, then we're going to push backwards. This is called extension. So we're going to push backwards. So remember, if we're doing the extension movement or the flexion movement, 2 seconds forward, 2 seconds back, 2 seconds back, 2 seconds forward. So now we're actually trying to strengthen that muscle. Okay? This is number 4, backwards, forward, backwards. And if we wanted to advance this, we can actually put this through different ranges of motion, but still isometric. So what I mean by that, we're just holding for 2 seconds each time. But for instance, in flexion, instead of staying neutral, now I could actually come forward an inch and still push forward from there for 2 seconds. And I could come backwards a little bit and push backwards from there. And again, we just want to do 10 simple reps of that. Same thing in what we call lateral flexion. So we're going to hold on the one side while we push against our hand for 2 seconds. We're going to push against our hand for 2 seconds. And we're going to repeat this 10 times as well. Okay? So we're going to do 10 in total. So that's 5 on each side. So we're at number 4, number 5. And again, just 2 seconds. Nice, gentle, controlled. Number 6, number 7, number 8, number 9. This is giving strength and stability to the area when we're suffering with a disc bulge. All these movements are meant to actually serve a purpose. So simply first, number 1, the ranges of motion are going to get some normal movement in there. Number 2, the stretching is going to get some flexibility into the muscles. Number 3, the isometric strengthening that we just did, and now we can do this in rotation as well. So we rotate one side, but we hold. We rotate. All of these are now attempting to strengthen the muscle, but by doing it in an isometric sort of way, we're really lessening the chance of any injury here. Yet we're still building some strength in the musculature surrounding the neck as well. Now, be careful with all these. When you have a disc bulge or disc herniation, especially be careful of the movements that go forward, because when we bend forward, remember that when we're talking about a disc herniation, it's like that jelly donut. So when we push on one side, it's going to squeeze jelly back out the other side. So again, all these exercises, you need to pay attention to what you're doing. If any of them cause you any pain or irritation, that's when we need to stop. Okay? These things should not cause pain whatsoever. Number 4 is what we call a median nerve floss. So you've got three main different nerves, the ulnar, the radial, the median nerve. And in a nerve floss, again, people get this confused. A nerve floss, what we want to do is arm just comes out to the side, and we're actually, think of what happens when you floss your teeth. You're not stretching it. So watch, the hand is going to come out this way, but we may go actually to the same side. When we floss our teeth, we're not trying to stretch floss. You can't stretch floss, so that's why we're not going to come this way. We're going to go this way and back. This way and back. What we're doing is we're just getting movement through the median nerve in this particular case, because that's the nerve that exits at the C5-C6 level. Okay? And we're just getting movement in the nerve. It's movement. This is not stretching. Okay? And we can do that obviously on the affected side. So if you have a C5-C6 disc bulge, that's affecting one side. In the case if that was affecting my right side, I would do the right side. If it was affecting the left side, I can do the left side. You can do both sides if you want to. Number 5, we can now start getting into neck extension. But now, instead of just using the hands, you could actually use a towel if you wanted to. Again, I still prefer hands for me, just for isometrics. But with a towel, you can actually go through that movement. And what you're getting is, again, you're essentially doing some isometric, some strengthening to try and get some strength back in there. And notice we're doing neck extension, because again, with a disc bulge, if I'm bulging one side, it's going to bulge. If I compress one side of the disc, it's going to bulge back out the other side. That we don't want. So again, flexion movements you need to be really careful with, because when we come forward, that's when we tend to bulge the disc out backwards. So you're going to find anyone suffering with a C5-C6 disc bulge, they're going to be far better off, in most cases, staying away from flexion type exercises that go to the extreme. And same thing, we could also do more of a neck traction movement. And this is important. A lot of people misuse the term decompression all the time. We do true non-surgical robotic laser spinal decompression. Simply stretching or tractioning something does not cause decompression. Decompression is negative pressure in the disc. But what you could do is also put the towel behind the skull, okay, right at the base of the skull, and you can actually pull upwards. And in doing so, we're getting a stretch that's supposed to give some stretching to the disc itself. That can take some temporary pressure, off the disc in there as well. That's not decompression, contrary to what it's called all the time, but it's more of a neck traction movement. And it actually can be beneficial. And again, you're just going to hold it for 2 seconds. You're going to do 10 reps of that as well. You now have a solid home exercise routine for C5-C6 disc bulges or C5-C6 disc herniations that may help with relief of neck pain, arm pain, hand numbness, and tingling in the arms and the hands from a C5-C6 disc bulge or a C5-C6 disc herniation. Remember, always do what's tolerable. And it's always a good idea to get clearance from your own doctor or therapist before doing any of these exercises at all. Now, if you want to learn about a revolutionary non-surgical treatment method that I've already touched upon that we've used to successfully treat patients with C5-C6 disc bulges, go watch this video next. This method has a 90% plus success rate and specifically targets the area of the C5-C6 disc bulge. Go watch this video next, please.